Hi, my name is Notori Hughes, and for this assessment, I'm going to be focusing on the foot and the ankle complexes, and specifically the feet turned out for a compensation during an overhead squat, which is mainly associated with tibial external rotation. So, with the feet turning out is when your toes point outward instead of staying straight, which can also affect the alignment throughout the kinetic chain, which is your feet turn out, that affects your knees, your hips, etc. And this can lead to an injury if it is not corrected. So during this overhead squat assessment, my client will demonstrate their feet turning out. This indicates a muscle imbalance involving overactive and underactive muscles. So the overactive muscles are commonly including the lateral gastrocnemius, the soleus, the biceps femoris, also the short head, and the tensor fasciae latae. And then the underactive muscles are the medial gastrocnemius, the medial hamstring complex, the gracilis sartoris, and I believe you say the popliteus. So the main causes, um, so with this compensation, it can be caused by altered movement patterns, muscle imbalances, or limited ankle mobility. And over time, these issues can actually lead to external rotation of the tibia, like I was mentioning, which also causes the feet to turn outward during the movement.
So to demonstrate what my client was doing, she, like we have mentioned, is doing an external rotation overhead squat, which would look kind of like so, feet pointed outward, hands above head, and she is squatting this way, which can lead to a lot of different negative factors in the long run. Okay, so this is just a quick demonstration. So we're gonna roll out our calves. So first we're gonna sit down and we're gonna put this foam roller. We're just gonna do one calf just for the sake of time. And we are going to prop our one leg up and we're going to press a little bit into that calf and slowly roll using our hands to kind of help guide our calf on this foam roller. While we do this, we do want to go slowly and we want to feel where there's tension. When we feel tension, that is when we want to pause and kind of hold and do a little bit of pressure therapy and kind of just hold it there for a second. So I'll just do a quick demonstration. So say I feel it right there. I am going to hold it there for, I would say, about 20 to 30 seconds. And then you can keep rolling, making sure that you're breathing while doing this. It can feel a little awkward in the upper chest, but you just have to kind of deal with it for this. You want to do internal and external of your calf, just rolling. Okay.
Next, I'm going to implement some static stretching for the gastrocnemius and the soleus to improve the flexibility and also restore proper range of motion in that area.
All right, so for the static stretch, I'm going to kind of demonstrate. I can't quite determine what the name of it is, but pretty much we're going to get in a downward dog position, which just looks like this. It's a yoga pose. And with this, we are going to bend one of our legs and we are going to try and push down our heel onto the floor. You are going to really feel it all right here. You want to make sure you're breathing through it because your head is kind of in a downward position. You don't want to pass out in that position. So you're going to be like this, and you're going to hold that pose. You really feel it up through there. You're going to hold it, and then once you're ready, you're going to rotate, making sure that your feet are also not turning out. I know that my client does have an issue with some external rotation, so we really want to make sure this is kind of a good position where you can kind of look at your feet and see where your feet are placed. You don't want any of this or any internal rotation. You want to make sure we're straight on. All right, so for this underactive muscle strengthening exercise, I'm going to be doing a glute bridge. So first we are going to put on the floor, feet flat, and we are going to actually lay on our back. We want to make sure that we're breathing through this exercise. Our hands are going to be placed down, and this is a very important step because you're actually going to be helping your glutes press towards the ceiling by pressing with your hands as well. So when you do this, you're going to take a nice deep breath and push your hips as far as you can towards the ceiling, and you are going to hold it, squeezing your glutes together. It's going to look a lot like this. Hold at that isometric phase, and then slowly going down, making sure you're breathing back up, and then we're going to go back down.
And finally, I am going to incorporate an integrated exercise such as a squat with proper form and foot alignment to reinforce the correct movement patterns and the neuromuscular control.
All right, so now I'm going to be doing a regular overhead squat, but first I'm going to show you what my client was doing. So she was doing an external rotation like we've been mentioning, and it was looking like so. And that can lead to a whole bunch of different factors that are very negative in the long run. So we want our knees to be over our toes and our legs to be shoulder width apart. We are going to squat down, making sure we're breathing through it, keeping our chest up high. Overall, this corrective exercise strategy follows the sequence of inhibit, lengthen, activate, and also integrate to address the external rotation and also improve overall movement efficiency. Thank you for listening.